So we're continually talking about the benefits of cold plunging, but are there dangers or cons to cold plunging? Let's get into it. As always, guys, thank you so much to my research team, and let us get to the meat of the video. Articles or studies we talk about will be linked in the description below. So while there's been lots of information coming out about how cold therapy is very beneficial, there are, of course, those who are spreading the cold therapy is bad for you, it's dangerous, don't do it, propaganda. Now, there are definitely some times and some conditions where you should not do cold exposure, and that's what we're going to talk about today. So the first article we talked about comes from heart.org. As you can imagine, if you have an existing heart condition, the shock of cold water can be pretty detrimental. Plunging the body into cold water triggers a sudden rapid increase in breathing, heart rate, and blood pressure, known as the cold shock response. This can cause a person to drown within seconds if they involuntarily gasp while their head is submerged. The shock also places stress on the heart and makes it work harder. Within minutes, the loss of heat begins causing other problems. Blood rushes away from the extremities to the body's core to protect vital organs, which means the fingers, toes, arms, and legs without good circulation, and can lead to a loss of strength and coordination. Now, this is, of course, if you are in the water too long. Being immersed in cold water triggers hypothermia faster than just being out in the cold, because water takes heat away from the body 25 times faster than air. Again, this is absolutely true. However, a lot of the early day myths about cold exposure and how quickly it can kill you have been disproven. A direct quote from this article is, "I would caution against it for anyone with a cardiac history," said Dr. Plunging, who noted that little research on the health effects of cold water immersion included people with heart conditions. People with heart conditions may also take medications such as beta blockers that lower blood pressure and reduce the heart rate, which could make it harder for the body to adapt to the shock of a sudden temperature drop. Now, of course, the shock of that can be lessened by acclimating the body to increasingly colder water over time, which is something that we usually tell people anyway. Don't just necessarily jump into 32-degree water, start at 50, 40, work your way down from there. The most dangerous time is the first 10 seconds to a minute when people try to get their breath under control. You can survive up to an hour moving around, but for those who are not accustomed to that cold water shock, it can be incredibly risky. And we've seen this before, where people will get in and their body will go into shock, they will tense up, and they literally cannot move. And this is often what causes drowning, when people fall into a cold lake. The second study came out of the UK. I really like this one because it quotes directly, "At the moment, the science to fully support cold water as a therapy is not available, and it's not yet known if there is a certain duration or temperature that works best." I like that because that's what we've been saying all along. It's so contingent on what your goals are and what you're accustomed to, that there is no set time, temperature, duration for anybody. And that is why it's so important to find what works for you. But getting back to the study, one of the things they said was one of the little known problems associated with cold water immersion is what's known as non-freezing cold injury. When we are exposed to cold, it's normal for the hands and feet to feel very cold or numb, and they may tingle or be painful on warming. For most people, these symptoms are transient, with normal sensations returning within a few minutes. But for those with non-freezing cold injury, these symptoms can persist in the affected area for many years due to nerve and blood vessel damage. So if you are concerned about your appendages when you are getting into cold water, there are neoprene gloves and booties that you can get to help protect your toes and your fingers from these kinds of injuries. Another issue is that it's not really known how cold is too cold when it comes to cold water immersion and non-freezing cold injury, because again, it is contingent on the way our bodies respond to cooling. Encouragingly though, one study from 2020 with cold water swimmers indicates that although they may have cold sensitivity, this was not associated with damage to the blood vessels in the skin. And again, if you're doing traditional cold therapy, you're probably not actually swimming in the water, so you're probably not in there long enough to do any damage. But again, monitor your body and how you're responding. And if you've never done it before, it's absolutely recommended that you do it with somebody there, just in case you do go into that shock. The last article came from Banner Health. Some of the possible drawbacks they listed were, of course, risk of hypothermia and frostbite if you stay in too long. Painful experience. Again, it can be extremely painful, especially if it's too cold too quickly, or if you stay in for too long. And then if you have a cardiovascular disease, it is very highly recommended that you check with your doctor first. Some of the safety tips that they said were to limit your exposure. Obviously, don't go at it alone. Know your body. Wear clothing. Don't go in naked, or just go waist deep. Now, I would not recommend just going waist deep if you're going at it from a brown fat activation perspective. But it is a good place to start if you are concerned about it. And of course, guys, we cannot talk about cold therapy without talking about the Ice Wellness Program. So the Ice Wellness Program was specifically designed to help you find your ideal time of day, temperature of the water, and duration to be into for your best health benefits. Some people do really well in the morning, some people do really well at night, and others do well during their ice plunge during the day. You only know if you start tracking your data and start figuring out what works for you. And that's where the Ice Wellness Journal comes in. It's also designed to help you track your mental and emotional growth rather than just your physical. And then if you join our 30-day challenges are designed to give you a good meditation mantra to help you get out of your head and just enjoy the whole process. There's a pre, during, and post meditation that comes with that, followed by a post-plunge workout session. It's a very quick 4-move workout just to help you start warming up naturally, avoid jumping into that hot shower right away, and get a little bit of exercise in. Check it out at ice-wellness.com.